I told you there are two different kind of heart diseases, two classes. One is the valve disease and the other is the muscle disease.
Right.
All the medium and the large size dogs, they
Right.
go through the muscle disease mostly.
Okay.
All those which are toy breeds, less than 10 kgs, less than 12 kg dogs, they go through the valve disease.
Any success stories that you would want to share with us, ma'am?
Oh yeah, I have many of them. When it comes to the term success in veterinary medicine or in cardiology, it's about how long have you given a pain-free life to your pet. Okay, a very beautiful story I would like to share. There was a Labrador who came to me as a referral patient. He came in a bedsheet, just a 2-year-old Labrador. And I show the record of this patient to everyone in all my presentations because it's a wonderful story. So this guy comes to me in a bedsheet with a huge pot-bellied appearance. It was a beautiful black Labrador. और वो ना एक बड़ा सा टाटा सुमो में टवेरा में आते हैं because 10 people come with that guy. It's a joint family. Wonderful pet parents, joint family. Why? And I realize it's a terrible cardiac patient, just a 2-year-old Labrador, terrible cardiac patient. Then what I do? Okay, we see it, पेट में पानी भरा हुआ है, chest में पानी भरा हुआ है, and the heart is so bulged out, it's like a balloon. So I couldn't do an entire cardiac evaluation because my patient was not able to lie down on the table for a long time. So what I do is I just immediately first we drained out the fluid. We use a 25 ml syringe. And I drained out the fluid for approximately 4 hours. Single syringe se nikal ke bhi approximately 6 to 7 liters of fluid from the abdomen, from the tummy, about 2.5 liters from the chest. And that day we send the patient back, saying that I want to see it back after the 3 days. So he comes back to me after 2 days, and he's still not very comfortable though, but at least there's no pot-bellied appearance. The breathing was much better. I evaluate him, and now I give him a nice detailed prescription and all the counseling possible. The entire family is sitting around like a class to listen to me. And so my first follow-up usually is approximately around 1 month to 45 days, depends upon what stage my patient has come in. So when a patient is coming in this stage, I call it as a stage C, third stage. ठीक है, 4 stages होता है, third stage patient है. 2 years age है, सोचो. Just 2 years old at his third stage. So now the story, the what do you call, the twist in the story is when he comes down to me in the follow-up, after about a month's time, the kid comes with a polythene bag in his mouth and he had a bread loaf. And जो उनकी दादी है, जो pet parents, उनके पूरा family आता है, जो उनकी दादी है, she says, "Ma'am, Bravo आपके लिए gift लेके आया है." Seriously accepted it. Videos and photographs. मुझे लगा कि मुझे पहले इसका हार्ट देखना है कि कैसा है. Because now my patient is coming, he's walking, he's smiling, the entire family is smiling. ठीक है. I checked him, 80% reduction in the reverse flow. Fantastic. 20% है, रहेगा. I know that 20% is going to be there. So I'm trying to explain you, Yash, here that it's all about what extent of pain-free life you give to the dog. Every single breath was painful to the patient. And now my patient is happy running around. So most of the changes in the heart are irreversible. 100% you cannot reverse, but you can do so much with the medicine that clinically your patient will look like that. But एकदम profound. Pet parent के लिए वो लगेगा, wow, it's incredible. Madam क्या magic क्या, इतना beautiful reviews लिखता है लोग, लंबा stories लिखता है. And I tell them, इतना पूरा story Google में लिखो ना, मजा आएगा. More people know about it. So it's like that. Because cardiology or the study of heart, the conditions of the heart is extremely valuable only when my pet parents are assisting me and identify. If you allow me to look into the heart, only will I be able to help you out. See, we all have a specified career, right? कितना समय हम काम करेंगे? आप मुझे बताइए, how many years do I have? But in whatever time I have, if I have struggled so hard to study and to reach a certain extent, I want more people to do it. I want to spread this awareness as much as possible. And you guys are doing a tremendous job. I must congratulate you for picking up this topic so early. समझ रहे हो? Because it's a very intensive topic. So you're not talking about क्या खाना खिलाना है, क्या पानी पिलाना है. You're getting into the depth, and I really like that. So, and now the twist comes. बाद में मुझे ध्यान में आया, इवैल्यूएशन पूरा हो गया, रिपोर्ट मैंने लिख दिया, and gave them a prescription कि ठीक है अभी जाओ, 3 महीने बाद आना, अभी मत आना इस बीच में. फिर मुझे लगा, मैंने पूछा आप लोग मेरे लिए ब्रेड ही क्यों लेके आए? कोई डॉक्टर के लिए ब्रेड लाता है? नहीं लाता है ना?
नहीं.
So, the explanation given by the grandmom was, मैम ब्रावो को ना हम डेली सुबह 50 रुपया देते हैं, वो जाता है बाजू वाली दुकान से ब्रेड लेके आता है, खुद खोलता है, बैठता है, खाता है, एंड कवर ले जाके कचरा में फेंक के आता है. And they were so proud in saying that. So the 2 whole years, the dog has been eating only bread loaf. See, what an important part of information I have lost. अगर वो मेरे लिए ब्रेड नहीं लेके आता तो मुझे पता भी नहीं चलता. Because the patient came to me in a critical stage, and probably I missed asking them this question कि क्या खा रहा है dog. To me it was more like, अरे यार by birth disease तो नहीं है क्योंकि 2 साल का dog है. So the structure of the heart was fantastic. It was just ballooned up. And that ballooning has happened, in my opinion, mostly because of the carbs. Dogs cannot tolerate more than 20% of carbohydrates. So please, dear pet parents, dahi chawal is not a diet. Please don't do that. Don't come and tell me that कि मेरा कुत्ता दही चावल बड़ी खुशी खुशी खाता है. आप वो देते हो इसीलिए खाता है. मैम हम संडे को चिकन बनाते तो डॉग चिकन खाता है. संडे को तुम खाओ चिकन. Every single day, your dog is supposed to eat protein to the extent of 80%. Some pet parents come, ma'am, I'm a vegetarian.
Yeah.
Dogs are not vegetarian. Please guys, they are not vegetarian. मैं खुद ब्राह्मण हूँ. नवरात्रों में मेरे यहाँ 9 days we fast और पर चिकन बनता है. We cook chicken. I have 3 pets. We cook chicken. Even if they're eating dog food, my dogs don't eat dog food without chicken. मैं देती हूँ. I'm absolutely fine with it. Please understand. Try to discuss about the nutrition, the importance of nutrition. And let me tell you one simple thing which I have been telling all my pet parents. Please pay attention to this. Human foods are the most expensive food. 80% of your earning goes into your kitchen.
Right.
And for all the women out there, I'm telling you, do not buy excess food. हर महीना शॉपिंग करो. 1 साल का चावल मत खरीदो. It's not beneficial, guys. See why Westerners are more advanced in thinking. Do you know that? Because they calculate this. चावल खरीदना, दही खरीदना या दूध बना के दही बनाना, your time into it, आपका गैस, everything is money. It is far more expensive than the dog food. Go for good quality dog food, please. उसके पीछे पढ़ के तो देखो कि कितना परसेंटेज प्रोटीन है. ये छोटा छोटा अक्षर में लिखा होता है कि कौन सा प्रोटीन है. लंग्स, लिवर, ये सारी चीजों से बना हुआ प्रोटीन हो या फिर एक्चुअल मसल प्रोटीन है. मैम लैब्राडोर है मैम, कहाँ मैम रोज का 500 रुपए हो जाता है डॉग फूड में. ठीक है, 1 टाइम हाई प्रोटीन डॉग फूड दीजिए, 1 टाइम इकोनॉमिकल डॉग फूड दीजिए. या फिर मैम दोनों टाइम डॉग फूड नहीं खाता है डॉग, मैं क्या करूं? नो प्रॉब्लम, चिकन लेके आओ, थोड़ा वेजीज डालो, बॉइल करो, दे दो. चावल इज नॉट एन ऑप्शन. चावल इज नॉट मैंडेटरी. मैम सुबह सुबह इसको 2 रोटी मलाई लगा के दे दो, खुशी खुशी खा लेगा. You can't imagine, you know, what kind of statements I get. मलाई रोटी, मक्खन रोटी, जवारी की रोटी खाता. millets मैम, millets आप खाओ. Your dog does not need millets, he needs proteins. ठीक है? So being on the less protein diet leads to muscle deterioration very early. My observation, though the research has not proven it, but in humans it has been proven that it can lead to hypothyroidism. Eating less proteins can cause hypothyroidism. I feel it is very pronounced in animals, hypothyroidism. और थायराइड कम हो जाता है तो हार्ट डिजीज बहुत ज्यादा होता है. So these things are absolutely crucial information for a pet parent to remember, and please spread this information to every single pet parent that you know.
Yeah.
लिख के डालो यार, मैडम ने बोला चावल नहीं खिलाने का है. And please do not do drastic transitions to the dog food, because they are not good at taking that. Shall I tell you one small example,
Sure.
if you have a minute?
Sure.
We are people like this, longitudinal. मेरा digestive tract ऐसा है, मेरा food pipe ऐसा है, और मेरा tummy ऐसा है, मेरा stomach ऐसा है, right? लेकिन मेरा intestine सब ऐसा है, horizontally. Whatever I'm eating, my organ of prehension, यानी कि मेरा organ जो मेरा खाने को मेरे मुंह तक लेके जाता है, मेरा हाथ है. I'm a volunteer eater. Right? So my organ of prehension is my hand. I am a picky eater. I'm a choosy. I'm a volunteer eater. On the other hand, your pet, your dog, has a horizontal digestive tract. उसका सिर्फ neck कितना होता है? This is the only inclination he has. Whatever he eats, going down onto the digestive tract, has always should be in a intestinal movements, which is not more than 20 to 30% of very, very slow contraction. So imagine a pipe. If your digestive tract is a pipe like this, whatever you eat, zap, जाता है ना नीचे. आधा तो ग्रेविटी से चला जाता है, right? इस और इंटेस्टाइन्स में हॉरिजॉन्टल है हमारे पास, तभी तो हम सबकी टम्मी आती है, पॉटबेलिड अपीयरेंस, अपन सबका पेट ही तो बढ़ रहा है. Next, for a dog, horizontal digestive tract, everything goes by intestinal movement. So if human foods are like slurry, है ना, चावल जो होता है slurry होता है.
Right.
You can imagine a dog. It's so difficult for the dog to, if this is the bowl, it's so difficult for the dog to lift up the food, go back, throw it like that. That is how a dog eats.
Yeah.
अगर ये dog का tongue है ना याश, if this is the tongue of the dog, if this is the bowl, he will lift the food like that, make a pocket like that, gets into the mouth, throws like that.
Correct.
Right? Imagine rice. कितना जा रहा है? जब dog rice खाता है, he just lifts up multiple times. Imagine you are not giving him a satiety to eat, क्योंकि उसका morsel ही नहीं बन रहा है. That is the very reason why the concept of dog food has come in. There is a huge research into that. इसीलिए pellets बने हैं ताकि वो kibbles and throw it. And then what will happen is, if it's wet food, like जो भी अपना वो होता है, क्या बोलते हैं, slurry, the human foods, उसने खा लिया, ये pipe आपका horizontal pipe है. So pipe में slurry forms a layer like that. No matter how much the intestines are pushing, it will not go to the extent. So digestion का concept क्या है? You eat, so you digest, you absorb, whatever is not absorbed, you eliminate. Digestion stomach में होता है, absorption in small intestines में होता है, और elimination large intestines में होता है. इधर से इधर जाना, इधर से इधर जाना, उसका specific time होता है. तभी आप अपने food को utilize कर पाते हो. That is called as a balanced eating, whatever you call it. That is how the system should work. But एक slurry move ही नहीं कर रहा ना. जब slurry move ही नहीं कर रहा है, तो digest क्या करेगा, absorb क्या करेगा, निकलेगा क्या? Doesn't it make sense? On the other hand, if a dog is eating kibbles, it will form a morsel, tight morsel, because it is dry. एक morsel बनता है, and see, imagine something forming like a lump or a hard thing. It occupies the entire the pipe, food pipe, and it is easy for me to push off. Isn't it? मेरे थोड़े से contractions में मैं push off कर दूंगा ना. आपको पता है ओल्ड एज में हम लोगों में भी फाइबर खाने के लिए क्यों बोलते हैं हाई फाइबर डाइट, हाई फाइबर डाइट, ओबेसिटी में हाई फाइबर डाइट. फाइबर क्या करता है? बल्क बनाता है. बल्क से आपके इंटेस्टाइनल मूवमेंट्स अच्छे होते हैं. Okay, that is the reason why we say eat high fiber diet. But for pets, it's a mandate to put them onto a morsel. So the morsel can be pushed off in a given period of time. They digest it, they absorb all the proper nutrients, and whatever is not absorbed will come out. Another thing, whenever we are calculating about the amount of money that you're putting in or the extent you're spending on feeding the dogs, you have to be a little calculated.
Okay.
If I'm feeding अच्छा brand का dog food, तो अच्छा ब्रांड का डॉग फूड अच्छे से एब्जॉर्ब होता है तो थोड़ा सा स्टूल पास करेगा, because most of it is getting absorbed. It's utilized. And trust me, all the good quality dog foods, you just need in small quantity. जो हाई कार्बोहाइड्रेट डाइट्स या फिर हाई वो होता है ना, वो बोलते हैं 550-600 ग्राम दीजिए एक दिन में. हाई प्रोटीन डाइट 150-200 ग्राम दीजिए. तो ऐसा नहीं, ऐसा नाक पकड़ रहे हो आप. It's the same, isn't it? So like that. So my suggestion to you all, and rather a humble request is, if you want to maintain your pet healthy, which every pet parent wants to, whoever is watching this, I'm sure they're curious. I'm sure they're interested in maintaining their pet health. That's the reason they're watching it. To all of them, it's a big salute. Apart from that, I want to suggest them, please try to slowly convert your pet. If you have not done it yet, please slowly convert them to a good high protein diet. Discuss with your veterinarian what food I should recommend at what age and what quantity. Please help me understand that. So you sit down, 5 minute का time लगता है. Sit down, calculate the finances. Okay, इतना time में इतना हो रहा है, इतना time में इतना हो रहा है. Also calculate the finances for what you have been doing. Trust me, you will be amazed how much money you save. And you give good health to your pet together. It's a two-way benefit.
Ma'am, we've reached the end of the episode, but usually I have some statements in mind, but today I'm blank because I've learned so much and there is just so much more to know, I guess. As a pet parent, there's so much more to learn. Thank you very much for, I'm extremely glad and grateful to you that you accepted a request and came on the show today.
I'm all on to it. Thank you so much. You guys are doing fantastic job. And I have never seen a company coming forward to do this for the pet parents. I have always, and to be honest, you're not directly related to them. तुम हमको related हो. But
Yeah.
I'm just, I'm just trying to be very honest, very crudely honest. So people need to think, इतना crucial information, एकदम authentic information, first-hand information जब हमको मिल रहा है, so make the most out of it, and
Yes.
parents try to watch out as much as you can, share it as much as you can, create that kind of awareness, because when the information goes from the grassroots level, the suffering goes down. And a big thanks to you guys for doing this job. I think most of us should learn, how to do something. This is more like a goodwill to you guys, no?
Right.
What way are you
There's nothing else
getting
for us.
benefited out of this?
Yeah.
मुझे नहीं लगता है कि you guys are getting directly
Absolutely.
benefited out. We are not expecting pet parents to buy your software.
I would urge all pet parents that I know that you have seen the whole episode. I'm looking right into the camera now, but you have seen the whole episode. But guys, just go back, if possible, watch most part of it, and this time sit down with a book and a pen, and note down the most important points that you find that that should be a part of your practice. So please do it. It's been a great episode. Thank you so much for being here, ma'am.
Thank you.
And
God bless
yeah,
you guys.
hopefully, thank you very much, and I hope to see you soon again.
Sure,
maybe
you're
with
welcome.
some other topic, or maybe just go more in depth with cardiology.
Yes, there's
So
so
we'll-
much in the cardio. I'll be more than happy to be of any assistance. And just spread the awareness. That parents, please do that. Please do that. And there's no guilt feeling. It's just lack of knowledge. It's just lack of
Right,
information.
exactly.
And so the target of you and me, or Yash, me, you, everyone should be to reduce the suffering. And the same thing is true with yourself. The same thing is true with your parents. Okay, get their heart checked. It's no different.
Right.
Get your heart checked too. At the age of 40-45, it might need some help. Okay, so cardiology is not just about pets. It's about everything. So it's all called as a One Health program. It's about reading about both the human and the animal health, and trying to spread the awareness among the human side. There's so much work going around, but there's so much lacuna in veterinary medicine. So to spread this thing, we have recently started. I mean, it took me a lot of effort to start what I call as a veterinary cardiovascular society. And it's just been 2 days that I got my certificate for it.
Wow.
So it is now a registered. Thank you, appreciate that. So it's now a registered body, Veterinary Cardiovascular Society, and we would love to associate with some good Samaritans like Pawzeeble, wherein we are also thinking of spreading awareness both to the pet parents, to the veterinarians, and get into the deepers and interiors of the country to create the awareness of heart. And there is 29th September is considered as the World Heart Day for humans. And very soon, I hope that we plan out a day for veterinary medicine too.
Absolutely.
So for that, we need your help.
We will,
Let's
it's my word
together.
to you. It's my word to you that, if you need anything from us, any support or
We
anything
will.
that
Let's
we need to
work
do.
together, Yash. Yeah.
Yes, absolutely. Absolutely. We would
Awareness
be the
is
first ones to come.
something we need to spread. Awareness is something that is the key to the early diagnosis. And early diagnosis is the key to happy life. Trust me, zero suffering. Thank you so much for watching.
Thank you so much. Thank you so much again. And thank you so much.
I really appreciate the invitation. I truly enjoyed it. God bless you guys. Keep doing the good stuff. Thank you.
Thank you. Thank you.
See you. Bye.
See you.